What is the position of the coracobrachialis muscle relative to the short head of biceps brachii? Anterior, medial, distal, or lateral? Medial. The relationship is medial because the coracobrachialis runs along the medial side of the arm. It is not distal because they share the same point of origin and run parallel, not in a sequence. It can also be described as posterior, as the biceps is more anterior. How is the superior gluteal nerve positioned relative to the piriformis muscle? Anterior, superior, inferior, or posterior? Superior. Piriformis muscle divides the greater sciatic foramen. The superior gluteal nerve passes through the suprapiriform portion, placing it superior to the muscle. What is the position of the quadratus plantae relative to the flexor digitorum brevis? Medial, superficial, lateral, or deep? Deep. The quadratus plantae is a deeper muscle that lies underneath the flexor digitorum brevis. How are the medial and lateral menisci positioned relative to the tibial plateau? Inferior, superior, anterior, or posterior? Superior. They sit on top of the tibial plateau, deepening the articular surface to improve joint stability. What is the position of the obturator externus relative to the obturator foramen? Inferior, lateral, superior, or medial? Lateral. It is located on the outer, lateral side of the obturator foramen. How is the superior articular process positioned relative to the inferior articular process? Inferior, anterior, posterior, or superior? Superior. In vertebrae, the superior process is above the inferior one, forming the facet joints. What is the position of the anterior cruciate ligament, ACL, relative to the tibial plateau? Anterior, posterior, superior, or inferior? Anterior. The ACL attaches to the anterior intercondylar area of the tibial plateau, preventing anterior translation of the tibia relative to the femur. What is the position of the palmar radioulnar ligament relative to the dorsal radioulnar ligament? Anterior, posterior, superior, or inferior? Anterior. The palmar radioulnar ligament is located on the anterior side of the wrist joint. What is the position of the medial pterygoid plate relative to the nasal cavity? Lateral, medial, superior, or inferior? Lateral. The medial pterygoid plate forms a lateral wall of the nasal cavity. How is the fibular collateral ligament positioned relative to the tibial collateral ligament? Anterior, medial, posterior, or lateral? Lateral. It is on the outer or lateral side of the knee, while the tibial collateral is on the inner. What is the position of the stylohyoid muscle relative to the digastric muscle? Superior, anterior, inferior, or posterior? Posterior. Stylohyoid is located behind the posterior belly of the digastric muscle. How are the superior and inferior articular facets positioned in cervical vertebrae? Inferior, superior, posterior, or anterior? Superior. In the cervical vertebrae, the superior articular facet faces upward and backward to articulate with the inferior facet of the vertebra above, which faces downward and forward. What is the position of the radial collateral ligament relative to the annular ligament? Posterior, distal, proximal, or anterior? Distal. It is located distal to the annular ligament on the radial side of the elbow joint. How is the arcuate line positioned relative to the arcuate ligament? Anterior, posterior, superior, or inferior? Inferior. The arcuate line and the arcuate ligaments are located in different parts of the body and have no direct anatomical relationship. The arcuate line is in the lower abdomen, while the arcuate ligaments are associated with the diaphragm in the upper abdomen and thorax. What is the position of the conus medullaris relative to the cauda equina? Posterior, inferior, superior, or anterior? Superior. The conus medullaris is the tapered, superior end of the spinal cord, above the nerve roots. How is the soft palate positioned relative to the hard palate? Posterior, medial, anterior, or lateral? Posterior. The soft palate is located behind the hard palate, forming the back part of the roof of the mouth. What is the position of the medial circumflex femoral artery relative to the femoral neck? Superior, posterior, inferior, or anterior? Posterior. This artery runs behind the femoral neck, a crucial blood supply to the femoral head. What is the position of the medial lemniscus relative to the midline of the brainstem? Medial, lateral, anterior, or posterior? Medial. The medial lemniscus is a sensory pathway located close to the midline, carrying proprioceptive and fine-touch information. What is the position of the inferior colliculi relative to the cerebral aqueduct? Anterior, posterior, superior, or inferior? Posterior. The inferior colliculi are located posterior to the cerebral aqueduct in the midbrain and are involved in auditory processing. What is the position of the lens relative to the iris? Anterior, posterior, superior, or inferior? Posterior. The lens is located posterior to the iris, suspended by the zonular fibers within the eyeball. What is the position of the ciliary body relative to the iris? Lateral, anterior, posterior, or medial? Posterior. It is located behind the iris and produces the aqueous humor. How is the sphenoid sinus positioned relative to the sella turcica? Inferior, superior, posterior, or anterior? Inferior. The sinus is located below the sella turcica, which houses the pituitary gland. What is the position of the utricle relative to the saccule? Posterior, anterior, superior, or inferior? Posterior. The utricle is positioned behind the saccule within the vestibule. What is the position of the scala vestibuli relative to the scala tympani? Medial, lateral, superior, or inferior? Superior. In a cross-section of the cochlea, the scala vestibuli is the superior chamber, located above the cochlear duct, which in turn is above the scala tympani. How is the basilar membrane positioned relative to the tectorial membrane? Medial, inferior, superior, or lateral? Inferior. The basilar membrane lies below the tectorial membrane within the cochlear duct. What is the position of the inculus relative to the stapes? Distal, anterior, posterior, or proximal? Proximal. Within the acicular chain, the incus is immediately proximal to the stapes, connecting the malleus to the stapes. How are the anterior and posterior semicircular canals oriented? Oblique, vertical, transverse, or horizontal? Vertical. They are oriented vertically, while the lateral semicircular canal is horizontal. What is the position of the genicular anastomosis relative to the knee joint? Around, within, inferior, or superior? Around. This network of arteries surrounds the knee joint to provide collateral circulation. How is the cruciate anastomosis positioned in the gluteal region? Anterior, superior, posterior, or inferior? Posterior. It is found posteriorly in the gluteal region, providing an important collateral pathway. What is the position of the subclavius muscle relative to the subclavian vein? Superior, anterior, inferior, or posterior? Superior. This small muscle lies above the subclavian vein on the first rib. How are the costocervical trunk and thyrocervical trunk positioned? Anterior, posterior, superior, or inferior? Posterior. It is the posterior branch of the subclavian artery, located deep to the more anterior thyrocervical trunk. What is the position of the vertebral artery relative to the subclavian artery? Lateral, superior, medial, or inferior? Superior. It is the first and most superior branch arising from the subclavian artery. How is the internal thoracic artery positioned relative to the transversus thoracis? Anterior, medial, lateral, or posterior? Anterior. It runs vertically, anterior to the transversus thoracis muscle. What is the position of the inferior mesenteric artery relative to the abdominal aorta? Anterior, posterior, lateral, or superior? Anterior. The inferior mesenteric artery is a major anterior visceral branch of the abdominal aorta. What is the position of the conjoined tendon relative to the inguinal ligament? Posterior, anterior, superior, or inferior? Posterior. It reinforces the posterior wall of the inguinal canal, lying behind the ligament. How is the lacunar ligament positioned relative to the pectineal ligament? Medial, lateral, superior, or inferior? Medial. It is a medial extension of the inguinal ligament, located medial to the pectineal ligament. What is the position of the hepatogastric ligament relative to the hepatoduodenal ligament? Inferior, superior, right or left? Left. It forms the broad, left part of the lesser omentum, connecting to the stomach. What is the position of the gastrosplenic ligament relative to the splenorenal ligament? Superior, posterior, anterior, or inferior? Anterior. It forms the anterior layer of the splenic pedicle, connecting the stomach to the spleen, anterior to the splenorenal ligament which connects the spleen to the kidney. What is the position of the phrenicocholic ligament relative to the spleen? Inferior, superior, lateral, or medial? Inferior. This ligament supports the spleen from below, forming a shelf at the splenic flexure. How is the transverse mesocolon positioned relative to the duodenojejunal junction? Inferior, anterior, superior, or posterior? Anterior. It passes in front of the duodenojejunal junction when the colon is in its normal position. What is the position of the sigmoid mesocolon relative to the left ureter? Lateral, medial, posterior, or anterior? Anterior. It lies in front of the left ureter as it descends into the pelvis. How are the medial and lateral arcuate ligaments positioned? Lateral, superior, medial, or inferior? Medial. It is the more medial of the two, arching over the psoas major muscle. What is the position of the median umbilical ligament relative to the medial umbilical ligaments? Inferior, superior, lateral, or medial? Medial. It is the single midline ligament situated medial to the paired medial umbilical ligaments. What is the position of the common hepatic artery relative to the portal vein? Anterior, posterior, lateral, or inferior? Anterior. Within the portal triad of the liver, the common hepatic artery is consistently positioned anterior to the main portal vein. What is the position of the obturator nerve relative to the obturator foramen? Through, above, below, or around? Through. What is the position of the mesonephric duct relative to the paramesonephric duct? Anterior, medial, posterior, or lateral? Lateral. Despite what the image might suggest, the mesonephric duct is lateral to the paramesonephric duct during early development. In the developing embryo, the mesonephric duct forms first. The paramesonephric duct then forms laterally to it, but it grows in a way that it eventually crosses ventral to the mesonephric duct and comes to lie on its medial side in the final stages before sexual differentiation. How is the genitofemoral nerve positioned relative to the psoas major? Anterior, within, posterior, or inferior? Anterior. The genitofemoral nerve lies on the anterior surface. How is the bulbous cordis positioned relative to the primitive ventricle? Superior, inferior, posterior, or anterior? Anterior. The bulbous cordis is the embryonic arterial outflow channel. Its position anterior and superior to the primitive ventricle is crucial, as it will eventually undergo complex remodeling to form the smooth-walled parts of the adult heart's ventricles, specifically the conus arteriosus of the right ventricle and the aortic vestibule of the left ventricle.